Come in.
Hello, I'm Tracy. I'm going to be doing your physical assessment today. Would you like to empty your bladder before we get started?
No.
Awesome sauce. All right. She appears to be in normal behavior. She's calm and well groomed. Let's see. And your first and last name?
Brenda O'Neill.
And your date of birth?
6/19/75.
Okay. And where are you right now?
I'm in Cunningham.
And what's the year?
2021.
Okay. She's alert oriented ×3. And if for some reason there was a fire or something, what would you do?
I would jump out the window.
Okay. And her reasoning is intact. All right. Let's go ahead and move to your assessment. Okay. First thing I'm gonna do is inspect your head. Okay. I'm inspecting the scalp right now. Head seems to be without any lumps or lesions, and she has a normal cephalic, and face is symmetrical. Now we're gonna move on to the eyes. Looking at her eyes and her eyelashes. Eyes are symmetrical. Sclera is white and conjunctiva is pink. All right, moving right along. All right, we're going to test your vision, okay? So I'm going to have you look at this chart right over here, okay? And if you can cover one eye and read the smallest line you can see.
QUIOP.
All right, and cover the other eye.
QRSTU.
All right. Okay, and it looks like she has 20/20 vision. All right, next thing we're going to do is we're going to test your vision some more. All right, if you can follow my nice little pen light. Get it out. All right, here we go. All right, what I want you to do is keep your head straight and just follow this with your eyes, okay? Awesome. All right, and also what I want you to do is cover your one eye. All right, and I want you to tell me what number I'm holding, okay?
2.
Awesome.
2. 3.
Okay, and cover your other eye.
4. 1.
All right, and we'll just test her confrontation. And then also let's go ahead and check your pupils. Just look straight ahead in my nose. Awesome. And pen light, just take a look at it and with your eyes and follow wherever it goes, okay? All right. Pupils are equal, round, and reactive to light and accommodation. We've also tested the cranial nerves 2, 3, 4, and 6. All right. Now I'm going to get my other gadget, otoscope, and look straight at me. All right. All right. And red reflex was noted bilaterally. All right. Now we're moving along to your nose. The nose is midline, no apparent deviations, and her mucosa is pink and moist. All right, do you have any trouble with your breathing or anything like that, or with your nose? All right, so now I'm going to test your sense of smell, and so what I want you to do is, when I tell you, I want you to close your eyes and cover one nair. I want you to take a smell the substance that I'm going to give you to smell, and then after that, we're going to cover the other nair and do the same thing, okay?
Yeah.
All right, close your eyes for me. All right, cover one nair, please. And what do you smell?
Pepper.
All right, cover the other nair. And what do you smell?
Garlic.
All right, sense of smell is intact. We also tested cranial nerve number 1. All right, moving on along to your ears. I'm going to touch your ears and let me know if you have any tenderness or pain with the touch, okay? Palpating her pinna, and her tragus, and her mastoid. Any pain with that?
No.
All right, and all right, and I'm going to take a look into your ear. I'm going to move this up, pulling it up and back, and looking in. All right, and the same side. Okay, awesome. All right, and her tympanic membrane is pearly white with cones of light at 5 and 7. All right, we're going to also test some hearing. I'm going to whisper on one side of your ear, then the other side of the ear, and then you just tell me what I say, okay? Ready?
Mm-hmm. Salt. Chicken.
All right. And then also what we're going to do, hearing is intact. We're also going to use this tuning fork, and we're going to test for her Ryan and Weber's test. Cranial nerve 8. All right. Did you hear those equally?
Yeah.
What about now?
Yeah.
All right. And now?
Yeah.
Awesome sauce. Okay, we just tested cranial nerve 8. She has a positive Rhines and Weber's test. Okay, moving right along to her mouth. All right. Let's go ahead and taste cranial nerve 7. Can you do a big smile for me? And frown. And awesome. All right, cranial nerve 7 is intact. Do your favor. Can you clench down your teeth for me? Good job. All right, cranial nerve 5 is intact. All right, and can you stick your tongue out for me? All right, teeth are all present and intact. Gums are pink. Tongue is pink and moist. And can you stick your tongue out and say ah? All right, and can you do left and right? Awesome sauce. And then I'm going to test your gag reflex, okay? All right, gag reflex is intact. Gag reflex is intact. Cranial nerves 9, 10, and 12 are also intact. While we're here, let's go ahead and test your cranial nerve 11. Can you turn your face that way? Good job. And then the other way? All right, and shrug your shoulders for me. Up. All right, cranial nerve 11 is intact. All right, while we're looking at your neck, let's go ahead and test your carotid arteries. All right, carotid arteries are 2+ in amplitude, and we'll check for bruise. And no bruise present. All right, while we're at your neck, the skin is also warm and dry and intact. We're going to go ahead and check her thyroid. So her trachea, first off, is midline and with no deviations. Can you swallow for me? All right, and her, ooh, that's a good swallow.
You're pushing.
I'm sorry. Oh, I was just testing your, what was I testing? We test your trachea, and thyroid is also intact without any abnormalities. Moving right along, we are going to inspect your thoracic, in the front and the side. AP size noted, normal 1-to-2 ratio. We'll also have a listen, posterior chest. Can you take deep breaths for me, please? Again. 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 Breath sounds are clear to auscultation. I also want to check your skin back here.
Okay.
All right, stand for me. All right, skin is cool and dry to touch, and her spinous process to be normal, and paravertebral muscles are also intact and normal. Oops. All right. Let's go in sinuses. Maxillary and your frontal sinuses. Any pain when I touch?
No.
All right. And then while we're here, we're also going to test her lymph nodes. Preauricular. Let me know if you have any pain with touch.
Mm-hmm.
Postauricular. Occipital. Tonsillar. Submandibular. Submental. Superficial cervical. Post-cervical. Deep chain cervical. And supraclavicular. Any pain when I touch those?
Mm-mm.
Okay. No nodes, no nodes, no nodes palatable during examination. Also, let's check your axillary muscles, nodes. All right, can you hold your arm up for me? All right, lateral, central, pectoral, supraclavicular, infraclavicular. No nodes, palatable at this time. Let's check your. Let's go ahead and check your upper body extremities. I'm gonna check your brachial arteries first. Hold your arms out. And your radial arteries. Radial pulses. Brachial pulses are 2+ bilaterally. Radial pulses are 2+ bilaterally. Temperature of skin is cool, dry, and intact. Cap refill. Let's see, cap refill. Less than 3 bilaterally. Let's go ahead and let's test your range of motion. Can you turn your wrist? And can you open your fingers and close your fingers? Can you move your elbows up and down? Awesome. All right. Full range of motion in all bilaterally upper extremities. Let's also test your grasp and your strength. Can you squeeze my hands for me? All right, and then I'll open my hands. Let me close. Keep your hands closed. Awesome sauce. Also, can you put your arms up? All right, don't let me pull your arm. Excuse me. Don't let me push your arm down. Okay, now pull your arms up. Good job. All right, so now let's go to the anterior chest and listen for breath sounds there. Ouch. Shit myself in the face. Breathe for me. Breath sounds are clear to auscultation in the anterior chest. I will count her rate. Respiratory rate is 10 with no excessive effort, and rhythm is normal. All right, now we're going to auscultate for the aortic, pulmonic, Erb's point, tricuspid, and then the mitral. And then we'll flip the bell around. Same thing. Aortic, pulmonic, Erb's point, tricuspid, and the mitral. And then we'll count the apical pulse for 60 seconds. Excuse me. Okay, apical pulse was 58. All right. Now we'll check for, oh, you know what? I need to do percussion in the back. All right, and then CVA tenderness. Any pain when I did that?
No.
Okay. All right, and then if you can lay down for me with your knees slightly flexed, I'm gonna cover you up so no one can see your goodies. This mic is a little short. Oops. this over with. All right, I'm inspecting her stomach, and everything is even movement and contour. Now we're going to listen for bowel sounds in all 4 quadrants. Vowel sounds are normal and active in all 4 quadrants. Now we're going to listen for bruise in the aortic, renal, and femoral arteries. Aortic. Bless you.
Sorry.
Renal. And femoral. No breweries noted. Also, I'm going to check the femoral pulse. Femoral pulse with a 2+ amplitude. Now I'm going to do a light palpation in all 4 quadrants. Let me know if you have any pain or anything, okay? Any pain there?
No.
Okay. And then I'm going to do no pain noted or masses with light palpation. Now I'm going to do a deep palpation. Any pain with that palpation?
No.
All right. Deep palpation completed. No masses noted to deep palpation or tenderness. All right. Checking the liver. It's about 2 centimeters midline to the right. Any pain with that? No rebound tenderness. All right. Can you do me a favor and sit your head up for me? All right, no hernia also noted. All right, let's look at your lower extremities while we're down here. All right, and skin is cool and dry to touch. No edema noted to lower extremities.